Hello, you're welcome. This is Blessing Raji Aigbe. I'm a registered nurse and a health coach. In case you're meeting me for the first time, you're welcome. And why I'm doing this is to ensure that I help educate people on what it means to a adopt a behavioral change, right? To have a behavioral change towards their health. So this video is just for me to give you the importance of having a follow-up checkup done. Oftentimes when we meet people, probably after the first encounter, or maybe you had the test done by yourself, people tend to forget that there's a need for you to have a follow-up checkup done. While some tests might be so expensive for you to have a follow-up checkup done, there are little tests you can actually carry out that are cost effective and might not even cost you at all. So that people don't keep saying, I don't know how I was meant to have my follow-up checkup done and nobody told me. I am telling you now, right, that it is important for you to have a follow-up checkup done. So I'll be sharing with you why it is important for you to have a follow-up checkup done. So the topic is health follow-up metrics, right? Or you say follow-up metrics. So we want to know tracking your health progress. When you have a follow-up checkup done, you are able to know where you are and where you're going, what you have achieved. You are able to track your progress. And so this can be done. Sometimes you can, do this by yourself, and some other time you might also need the help of someone to help you do that. So I'll be sharing with us now on how to have a follow-up checkup done, why it is important to have follow-up checkup done. Okay, I hope you can see my slide. All right, so the reason why you need to have a follow-up checkup done is that number one, like I said, you'll be able to track your health record. Number two, you'll be able to know your numbers. Number three, you'll be able to know what to plan and how to achieve, your set goal. Number four, it gives you insight to knowing yourself, knowing your body, how your body works per time. So now we'll be looking at the follow-up metrics like the blood pressure, glucose, weight, and exercise. These are little things you can do. You can start, having a checkup, follow-up on these things, that this aspect, the blood pressure, the glucose, the weight, your exercise. Like for instance, your blood pressure, if you're not hypertensive, you can cultivate the habit of having it done once a week, twice a week, or at least that you're not so you're not so consistent. In a month, you have to have your blood pressure done once or twice. Yes, you don't, like, you're not living with any chronic disease. But if you're living with high blood pressure, you should be able to check constantly, at least 3 times a a week. So this is actually very different from when you search online. You can see that you're advised to check maybe like once a week, sorry, once a year. But as from my experience, right, you're supposed to check your blood pressure often. Your glucose maybe once in 3 months if you're not living with any form of chronic disease or diabetes. Then if your blood pressure is probably pre-diabetes or diabetes, you can then check often. Some people check, daily, depending on the stage. So some people also check once a week, depending on the stage, right? Some, it depends. So that's why you need to have, check up with your health coach or your doctor. Most times you need a health coach, like whether you have your doctor or nurse, you need a health coach that can guide you. Yes. So your weight as well, you can check your weight every month, and if you're not having any form of, planned treatment. Some people have planned treatment, like, maybe having a weight goal weight loss plan, then they can do daily. Yes, I've had you know coached prostate cancer members whereby we want to achieve weight gain and we have to start doing daily check. And the caregiver was able to do this very well. So daily check is possible for like at least once a month, once a month, once in 3 months. You should be able to check. Don't stay a year without checking your glucose. Then your weight, pardon, I beg your pardon. So for your exercise, you exercise daily. Yes, I understand that there are some apps that help you to, calculate your steps and all of that. You need to also record. Where I work with Terminal Healthcare, where they've provided, a health app that can help you log in all your records. So you'll be able to know how far you stay, you are consistent. Consistency is the key. So now let's look at the short story. Mrs. Ada used to feel tired, and she started checking her blood pressure, sugar level, weight, and exercise weekly. She didn't just start, right? She has access to a health coach who, after taking, a call with her, they were able to finalize that, okay, you need to check your blood pressure, sugar level often. Then within 3 months, she noticed her numbers improved and she also had like energy. She gained energy. So now what it means is that tracking small changes helped her, on the path of to better health. Tracking her record slowly within the space of 3 months, she was able to see what she has achieved, right? And if peradventure Mrs. Ada didn't achieve anything, it will help the coach and Mr. Ada to re-strategize on what the problem is and how to move forward. So now the key takeaway is that what you measure improves. Regular follow-up is equals to better health outcomes, right? So now, what are those key metrics to monitor? You have your blood pressure apparatus, you have your blood pressure, right? So you're able to track your health, your heart health. A lot of us carry a lot of responsibilities, that physically or mentally, right? And it affects our blood pressure. So blood pressure is the key thing, one of the key metrics that you should always track. You want to know how your heart is working. You want to know if your heart is stressed, So some other time we will to dwell on blood pressure and say why it is important to always check. So your glucose, it keeps diabetes risk under check. It keeps it low. We have some families diagnosed with diabetes already. It helps keep in check. And even when you are not diagnosed, right? It keeps the risk so that when there is any form of triggers, right, you're able to check. So I did it 10 years ago, 1 year ago. It's not enough, right? Prioritize doing all of these ones that will not cost you much. At least 3 times, at least quarterly. This helps you stay in check. And as time goes on, you're able to do the higher checks, right? So weight monitors healthy balance and lifestyle. Your weight also is a key thing to know. Your exercise as well, it improves your strength, it improves energy, it improves mood, right? You do not even know how important exercise is. So I encourage you to ensure that you do this regularly. And there is one other one, your height. See, a lot of people do not even know how tall, how short they are. Sorry. So they don't even know what their height says, right? So it's important for you to check. And if you're a young adult who is still, you know, growing, you check at you know what to expect. Some university students, as you're about to enter school, you check all of these things, to know what to expect and all that. So now the question is, what is your next step? When will you go for a follow-up checkup? What is your next step? When will you go for a follow-up checkup? Let me know. Practice makes perfect, they say. So where to check? I've heard a lot of people ask that now that I can no longer see, probably they met us at a community, what's it called, outreach. where we were. They said, now that I cannot see you, well, how do I check? You can check in a nearby pharmacy. You can check your blood pressure in a nearby pharmacy, your weight in a nearby clinic. You have clinic on streets, close to us. Just walk in and tell them you want to. They'll be glad to check for you. Most of them might not even charge you much. Some hospitals will do it for you free. Probably if they have patient, you just have to stay and check. You can do this on your weekend. It's a good habit, to inculcate in your daily lifestyle. You can check in a nearby hospital as well. Then if you have your BP apparatus at home, your equipment, you can check at home. You can secure one blood pressure apparatus. Now it's just like a property. Blood pressure apparatus is like a property that you need, to own. Blood pressure, sugar test, your weighing scale. I have all of this at home. Yes, you might say it's because that's because I'm a nurse, but we still have other nurses, other medical professionals out there that do not have this. So it's all about personal decision. So what next after check? Some people be like, so what next? And some people do like, yeah, so what next? What next is to record your results. Some people be like, I checked it last week. Oh, the upper value is, the lower value is, oh, okay, I forgot. Oh, no, 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 no. The first step to do is by recording. Number one, the traditional way to do it is by having your sheet, put it there. Some people are used to, saying it's just the hospital that, it's not just the hospital that can keep your health record. The hospital have access to your health record, and you also have access to your own, to keep your own health record. You can do this on a sheet. You can do this on Google Sheets, right? Yeah. And also, there is a health app also available for you to do this on. So now, after recording, what do you do? The next thing to do is to analyze. You have to analyze your result. Like Mrs. Ada did. Within a short period of 3 months, Mrs. Ada was able to analyze her record. Whether she did it alone or she did it with a health coach or she did it with a doctor, right? She was able to analyze. And because she analyzed, she was able to see where she was, what she has achieved. So now, after a given period, you can decide to analyze your results, which is very important, so that you know where you are. And also, you can share your results. Let's analyze together. And if you have any other question, you can drop. Thank you very much. I hope you'll be taking step to this, right? Let me know what step will you be taking after this. Thank you.